Hi, I'm Dr. Andrew Jones. Thank you for coming onto my podcast. Today I will be answering your questions about the coronavirus and ways you can be safe.
So Dr. Andrew Jones is a board-certified physician currently working at Cedars-Sinai Hospital, which is one of the top hospitals in the country, as well as Beverly Hills Concierge Doctors, the Masters in Molecular Microbiology and Immunology, a bachelor's with double major in microbiology and cell science and chemistry. He worked as a research scientist at the City of Hope for Biomedicine and Genetics, and a research associate at Norris Cancer Center, which is part of the USC Keck School of Medicine, and has taught microbiology.
Hi, I'm Dr. Andrew Jones. Thank you for joining me for another episode of Medical Matters, and today we're going to talk about, of course, coronavirus. To help me answer some of your questions, I have lovely Danielle Vargas here who brought your questions, and let's get started.
Hi. Thank you for meeting with me, Dr. Jones.
Yes.
First question, how are you doing?
That's a loaded question. I'm exhausted. Besides all the things I do in the clinic, I am working in a hospital with COVID-19 patients, so I'm watching the progression, the ones who survive, die, and so forth. So,
are there any updates on the symptoms?
Yeah, so what we're noticing as the symptoms progress and we have more and more cases, they're starting to notice that a lot of people present with diarrhea as an initial symptom, and then progress to the dry cough, the fevers, and the shortness of breath. Not to say everyone that has that is going to, obviously this is a respiratory virus, there's a range of symptoms, but that's what we're starting to see. So, yeah.
Wow, okay. How do scientists know that we're in for a surge of cases?
Yeah, because the coronavirus is a very contagious virus. There's something called the R0, which means for every person, and R0 is 3, which means every person that gets it, they can spread it to 3 people. The R0 for influenza, for example, is 1.2, so it's not as contagious as the coronavirus. So for every person gets the influenza, they can spread it to 1.2 persons. So what that means is by the time you realize who's sick, it's already spread. And like I said in prior podcasts, trying to stop COVID-19 is like trying to stop the wind. So
how does somebody know when they should go to the hospital? As
with any other respiratory illness, when you are very bad and you would go anyway. So people go to the hospital for the flu, for example. They go when they can't breathe, they can't eat or drink, they're getting horrible, they're not getting better. So same thing with the COVID-19. If you're not getting any better, you're getting worse, you can't breathe, then you definitely need to seek medical treatment.
Okay, it's good to know.
Yes.
Could I get my pet sick?
I get that question a lot. No, you can't, especially because of progression from bats to humans. No, you can't get your pet sick from COVID-19.
Okay, so then that means my pet can't get me sick.
Your pet cannot get you sick, so you're safe. Yes.
What about packaged foods? Can I get it from packaged foods?
Packaged food, especially in the grocery store, is pretty safe. The virus is not that viable on packaged items as opposed to other surfaces. So.
And can you, let's say I'm asymptomatic, can I still infect somebody else?
That is, yes, you can. And that's the reason for these high rates of coronavirus cases, COVID-19, because 25 to 50% they're finding out other people who have it don't show symptoms. So imagine your essential workers who are going around doing their job, infecting everyone, and that's why that curve is on the upslope. So if you look at the curve on the chart, which I showed previously, you'll see that even though we're staying at home, the numbers are going up exponentially. And so scientists say in the next couple of weeks, we're going to keep doubling.
So is there a natural cure?
Besides your immune system, which is great at getting rid of viruses, which is why 25 to 50% of people have no symptoms at all. And most people show minor and no when they get over it. So besides, I know there's talk about supplements, and I have this conversation a lot, and I really wish natural supplements work. For example, vitamin C, vitamin D, thiamine, because we've been doing studies for years, like decades, trying to find ways to help people in the hospital who are dying in sepsis, septic shock. And we'll say, hey, this patient has low vitamin D. Maybe if we give them vitamin D, we can save them. But nothing has.
Can you get it more than once?
This particular strain, no. Just like the flu, once you're immune to that strain of the flu, you're immune. But then it mutates. So with this COVID-19, once you get this strain, then you're immune. But as any RNA virus, it mutates. So as time goes on and it mutates, then you won't be immune to those viruses. Only the one that you're exposed to.
So, Dr. Jones, if I am positive, do I have a lifelong immunity?
For this strain, yes. Some viruses, you have a lifelong immunity. We're not sure about this one, but the way things are looking, you will have a lifelong immunity to this virus.
Does wearing a mask outside protect me?
No, and two things. A, people wear the mask the wrong way. Actually, I brought a mask with me just so you guys can see. This is a N95 mask that I wear in the hospital when I'm going to see COVID-19 patients who are confirmed or suspected. This mask protects me and it clears 99% of the airborne particles. The mask that people wear, like the basic surgical mask, does not protect you. And also when you're outside in the free-flowing air and so forth. So the chances of you getting sick is close to impossible. For example, somebody would have to cough and sneeze into the air before the wind takes it. And in those 2 seconds, you'd have to rush and breathe it in to even remotely have a chance of getting sick. As opposed to being indoors where the air is static and the air particles can stay suspended for hours, some studies have shown.
So, Dr. Jones, do NSAIDs such as ibuprofen make the coronavirus lethal?
That's a really good question, because this all started as a rumor from somebody in NYU who noticed that out of the people who died of the coronavirus, COVID-19, that some of the patients had taken ibuprofen. So they made a speculation, you know what, I think ibuprofen is making it worse and killing them. So, but if you look at the biochemical pathophysiology of COVID-19 and how NSAIDs work, there's no correlation as far as ibuprofen blocking COX-1 and 2 inhibitors and so forth and binding. There's no correlation in the pathway of how the COVID-19 binds to the receptors in, ACE receptors inside the lungs. There's no cross-reactivity. So that is a myth. So.
Dr. Jones,
yes.
Should women worry about COVID-19 during pregnancy?
The data is limited on COVID-19 during pregnancy because everything that's transpiring with the demographics and so forth is new. But from what I've read and have seen so far, no. They did a study of 33 Chinese women who tested positive when they were pregnant. And they, from pregnancy to birth, they found that on day 2, 3 of the newborns tested positive for COVID-19. 2 of them had minor symptoms like lethargy, they're weak and fever. From day 2 positive, day 6, they tested negative. They rebounded quickly, they got better quick. One of the infants was born to a COVID-19 pregnant woman who was having complications of COVID-19 with pneumonia, so they had to do an emergency C-section at 31 weeks. That baby had to be intubated, have the tube down the throat, but he got better quickly too. But we're not sure if his respiratory symptoms were from COVID-19 or from him being premature. But so far it looks like the virus cannot be transmitted in utero. But as things progress, we'll find out more. But because there's so many unknowns, a lot of people are making it difficult for pregnant women, limiting the interactions when they go to the maternity ward, not having any visitors, so the women are in labor by themselves. They don't have their partner with them to hold their hand like normal. There's a lot of fears, and also the recommendation for the CDC is that once the baby is born to a COVID-19 woman, to take the baby away from the woman for 7 days. But that's purely optional. It's not mandatory, but that's the recommendation: 7 days away from your child that's born. So
that's hard.
Yeah, there's a lot of things that we're trying to sort through right now.
So does social distancing work? Social
distancing on paper works 100%. Social distancing in practice has not worked. As you've seen in the earlier graph, which we'll put on up again, the numbers since we started to stay at home, the numbers have shot up exponentially, because if you look outside, people still going to the grocery stores, the gas stations, the laundromats, the banks, the post office, still going to fast food places, inside to order and out, still going to restaurants, inside and out. And even though a lot of places have like this tape, which is not even 6 feet apart, you're still breathing the same air someone else is breathing. And on top of that, even if you're wearing a mask, you're still touching everything, and you're touching your own objects, and you're going home with the virus. Even if you wear gloves, you're still touching everything, and your products that you touch, and then you take the gloves off, and everything else you touch, you're transmitting it. So that's the reason social distancing is not working. We're not really at home. We're not quarantined. Quarantine is if you're stuck at home. You can't go anywhere unless it's an emergency. So social distancing has unfortunately not worked the way we thought it would.
Following up with that, do you agree with the lockdown?
Some countries have been more strict with their lockdowns, therefore they were able to flatten the curve, which means the number of cases that they're seeing. I agree with the lockdown somewhat based on the way the numbers. So for example, South Korea did a great job of getting people to be compliant and so forth. We live in a society where we're free thinkers. We do what we want, First Amendment, and that's great. I love this country, but freedom is not really free. When you have freedom to make choices, there's a cost with that. And unfortunately, us not staying at home and being out and about and is causing the curve to shoot up like as you've seen. So.
How are the hospitals coping with the patient load?
The patient load right now in California is not as bad as, for example, New York. New York is being overloaded with patients. They're running out of equipment. They had a recent shipment from a football team, I think the Patriots, to help the doctors with masks and equipment. They're recruiting doctors and nurses from other states to help with this. And it looks like we're in for it too, which is what the scientists speculate. They speculate the next couple of weeks, as more people get infected, that there's going to be a surge of patients. But right now, the hospitals I've been to, we're maintaining. It's not hectic like in other places.
Oh,
but we're embracing for a storm.
Okay. So, Dr. Jones, what are some of the things that you're seeing in different hospitals?
I'm seeing different protocols in place and guidelines when it comes to COVID-19 patients. Some hospitals require you to wear shoes, a gown, goggles, a face shield, a double glove, and a surgical hat. Others just wear the mask and the gloves. Others, it's limiting visitors. Others, no visitors. Even some hospitals, even if the patient dies, the family's not allowed to go see that loved one who just died. It's a lot of things that they're trying to come up with. Some hospitals have thermal regulation where you walk through the door and they check your temperature, and if you have a fever, they won't let you in, or so forth. So it's different things I'm seeing at different hospitals.
It's interesting.
Yeah.
So, is there some type of mass antibacterial spray that can be sprayed amongst a hot spot, kind of like crop dusting?
There have been, the virus is very easy to kill outside the body, very easy. And Lysol, if you look in the back, it says kills the coronavirus. It's very easy to kill the virus on any surface, cell phones, everything, which is why it's recommended, along with washing your hands. Once the virus is inside your body, you can crop dust, so to speak, and spray a whole city. You can go to New York right now and just spray Lysol over the whole city. That will not change anything at all, unfortunately, with the COVID-19 patients, because the virus is dangerous when it's inside of you. So, and you're not crop dusting, or so to speak, use the question's term, is you're not doing that inside people's homes also. So people are still contaminated indoors and so forth. So, and like I said, the way air flows outside, the air outside is not the problem, it's the air inside. That's the problem.
That's good to know.
Yeah.
So what you're saying is it's potentially safer outside than inside. What's your take on investing in an air purifier for your home?
An air purifier, believe it or not, I can't believe no one's thought about this, would work wonders. Air purifiers, bacteria, dust, fungi, and viruses too. They have some that have been shown to kill viruses. So you have to get a good one. I know some people who buy some for their babies and it kills the viruses in the vicinity of the baby. They have some really good ones out there. So I would recommend to get that for the home, because you can't clean everything. But if you have a good product that will kill the virus on surfaces for you, then definitely invest in one.
Okay. I know what I'm going to go get when I get home.
Definitely. I have one actually in my home, so yeah.
So what about the air conditioner? Because it circulates that air. What is your take on that?
The filters in your air conditioning vent or heating vent is not the same filters as they use in a hospital, which is HEPA, HEPA. There's a large difference between those two. So the filter won't change anything. So,
out of the patients getting sick, what are the demographics?
I can tell you what we're seeing based on limited data. As by the time this next episode comes out, it'll be different. But what we're seeing is it's mainly affecting people over 65, people with high blood pressure, diabetes, kidney disease, obesity, underlying medical problems. Those are the people who it's hitting hardest, and the ones who are dying, unfortunately. So based on what I've seen in the hospital, I had a patient the other day, 77, who had high blood pressure and diabetes. He got worse, unfortunately expired. And just like I said with earlier, the hospital would not let his wife go see him. Even though she actually tested positive also, but she didn't have the same symptoms he did.
What craziest thing you have seen in the hospital?
The craziest thing I've seen in the hospital in reference to COVID-19 is, that's a good question. The craziest thing is the thermal screening before you walk into the door. If you look on the CDC's website, the World Health Organization website, and also the knowledge that we have out about how the virus works, if 25 to 50% of the people are asymptomatic, and some people don't even mount a fever, you go to the hospital, they check you have a normal temperature. That does not mean you don't have the virus. And then, as we talked about earlier, you can be a carrier and give it to everyone else. So that's the one thing that is happening. I know people are scared, but that doesn't change anything else. And plus, if you have a fever, it could be from something else. It could be from a urinary tract infection, a pneumonia, caused by bacterial infection, a fungal infection. It could be a lot of different reasons for having a fever. So I get the reason, the thought, and the rationale behind it, but it's in practice, from a medical scientific standpoint, it's not going to help flatten the curve or change anything or benefit us by doing that.
So what are some of the tried treatments in the hospital, and do they work?
So as we're going over trying different things, the tried treatment is Plaquenil, which is used as anti-malarial drug used to treat the malaria. It's been shown to help the patients who have COVID-19. Also azithromycin, which is a macrolide antibiotic, which is anti-inflammatory along with antibacterial. So those two have actually, in the recent studies, we got to do larger studies. This is just observation. They're starting to help people with COVID-19. Also, convalescent plasma, which is plasma with antibodies to the virus that they're giving to ICU patients, people who are really sick on a ventilator. And it's showing some promise in helping those patients to survive. Because once you're on a ventilator and develop severe ARDS, acute respiratory distress syndrome, your mortality rate at that point is 50%. So at that point, you got to try everything. Mm-hmm. So convalescent plasma, Plaquenil, azithromycin. Also, they found that the people who were really sick in that fluid in the lungs is an hyperimmune response. So that's from inflammatory cytokines that the immune system produces, like interleukin-6. So they have drugs that block interleukin-6 to help to reduce that hyperinflammatory response. And one of the hypotheses is that kids don't have this hyperinflammatory response. That's why the virus is not infecting them the way it's affecting adults. Last thing that I'm doing myself, they had a recent article in the New England Journal of Medicine showing that Tamiflu, if given for patients who come to the emergency room with suspected flu, even if they don't have test positive for the flu, influenza, Tamiflu actually helps those patients get over their symptoms. And also, they're also to notice also, this is all new data that came out, is also helping with other viral infections. So I give my patients Tamiflu, even though it's not, based on that new article, So that and some of the things that we're trying with patients with COVID-19.
Okay, it's good to know. Dr. Jones, how do ventilators help?
So, you hear a lot about the news about how they have COVID-19, they get worse and they get intubated on a ventilator. Ventilator just helps to push more of the air into the collapsed alveoli, which are pockets that the air goes into, and from the pockets, they go into the bloodstream and so forth and circulate in the body. So ventilators help to push that air into the lungs, through the body, to help you so that your body can get rid of the fluid. So once you have all that fluid, you can't breathe on your own. So the ventilators, so the body has to clear that fluid over time. So once you're in the ventilator, the hope is that let's give this person a chance to have their body heal itself and get better, and then we can lower the oxygen settings on the ventilator and extubate them and get them off of the oxygen.
What is the recovery time?
The recovery time varies, which is why there's so many different regulations at different hospitals. The recovery time varies in healthy people from a few days to sick people 14 days. For example, if one of the hospitals I'm at, if a patient is COVID-19 positive and then they get better in a couple of days, they still have to go home and self-quarantine for a total of 7 days. And then after their symptoms get better, another 72 hours. And then if their family members have been exposed, the family members have to be quarantined for 2 weeks also to help stop the spread. So it varies for different people. And this also differs for nursing home patients. If we have a nursing home patient who tests positive, they retest them again, and it's up to the discretion of the nursing home doctor to feel comfortable for accepting that patient back to the nursing home. Because you're with immunocompromised patients in the nursing home, the elderly, and you don't want them to get infected and have an outbreak. So it's very uneasy right now with everything. Like a lot of things will change over time as we get more information, and so.
Dr. Jones, how much longer do you think this is going to go on? Because they keep pushing back the amount of time that we're supposed to be staying indoors quarantined.
Yes. That is the $1 million question on everyone's mind, even our leadership and so forth, because we definitely want to get back the country back up and running and get people safe. But from what I've seen in the numbers, this is just what I've seen based on the data, it's going to be a while. Because if you look from March 13, 14, when they did stay at home, and then 2 weeks later, to end of March, the curve shot up. And the way this thing is spreading, it has a high R naught, which means it's highly contagious. But has a low fatality rate, which is good. So it's highly contagious. So it hasn't even spread, I think in the whole world, it's spread to 1 million people. And in the United States, it's much less than that. And you have over 300 million Americans. So if you do the data, people who are asymptomatic and those numbers, 10 times that, we still have a long way to go. So end of April was extended. So it will not be, unless we do something drastically, if we go on the current trends, we can be stay at home until August, unless something is changed based on the way things are progressing, probably to the end of August.
So, Dr. Jones, do you think there is going to be a second wave or a mutation of this virus?
There is definitely be a second wave. When and how devastating it's going to be, we don't know. And when I say devastating, I mean how many people are going to catch the virus. I don't mean to add fear to all the media out there right now, but definitely going to be a lot more cases, people involved and sick. And the surprising thing is, there's so many people who've tested, who have not been tested, who probably already had the coronavirus, that are actually walking around on the streets wearing a mask, trying to protect themselves, and they've already been exposed. But there's no way to know unless you get tested. So the second wave, we don't know. I saw some reports that 2 weeks from now, they speculate that we're going to double the cases and have a lot more cases. So if that's true, then I have to brace myself for being in the hospital and be prepared for this.
How does this virus compare to the other viruses?
Coronavirus comes from a family of viruses that have been around for hundreds of years, since the beginning of time, pretty much, if you look at the research. This virus in itself came from the family coronavirus. It mutated to cause SARS in 2002, then MERS in 2012, and then another similar SARS virus from 2002 called SARS coronavirus 2, which is 80% similarity to that virus. But that one killed 10 or 12%, had a fatality rate, but it wasn't as contagious. This one is more contagious, but less fatalities. So compared to other viruses, it still spreads, gives you a wide range of symptoms, as we've discussed. There's no way to know for sure who has it, who doesn't. And we just have to watch and see and learn more about it. As far as it mutating and so forth, it's an RNA virus, which means it's going to replicate very fast. Just like the HIV vaccines. HIV virus is a RNA virus. HIV has been known to rapidly mutate. That's why it's so hard to get a vaccine and get on top of it. But they've done a good job over time with the drugs and so forth. Same thing with this coronavirus 2. It has the largest RNA genome of this other respiratory viruses. So it has a high mutability factor, and it can change. So I would not be surprised if this is something we deal with every year, like the flu, where we're getting the coronavirus vaccine along with the flu vaccine every year. I see that happening.
What are some natural ways that you can fight COVID-19?
Just like I said, your immune system. Your immune system has two parts: an innate immune system, which you get exposed to things all the time, microbes, viruses, bacteria, fungus. Your body gets rid of it. If your your immune system can't do it from that standpoint, then you have the backup called the adaptive immune system, which adapts to any new infection. So even if you're a healthy person, exercising, eating right, healthy weight, don't smoke, then your body can make antibodies over a couple of days. You get slight symptoms and you get better. So that's the natural way. Any of the other supplements I've said earlier, because there's so many different cells in the immune system, how do you increase one without increasing the other? There's so many like pathways and regulations in the body that there's no way that supplements work. Like I said, we've tried them and we wish they did work, because a lot of people are dying, unfortunately, for infections every year, as you've seen on the numbers. But the natural way is your immune system again, and exercise. Exercise has been shown to increase circulation in the body, increase your T cells and white blood cells, which help to track infections in your body and get rid of them, and also raises your body temperature temporarily, which also kill infections also.
What are some ways that we can end this pandemic?
So some ways we can stop the pandemic is vaccines that we can use, mass produce, and give them to people who need it. Come up with new, better treatments, antivirals that can target the COVID-19 and get rid of it. And another way we can do this is, and over time, like naturally trickle out, because as the coronavirus spreads through the world, you're going to develop what's called herd immunity, which the people who are immune to the virus, they protect those who are not. And that's the whole premise behind people who vaccines. Like, some people can't take vaccines, but if a majority of people can get vaccine, don't have the infection, you can't transmit it to other people. And I would like to add this too. A lot of people ask me all the time, when is it safe to go visit my grandmother, grandfather, uncle in a nursing home, or I have a sibling or somebody unfortunately with cancer and chemotherapy, when can I see them? There is no straightforward answer to that, because even if you test negative for the coronavirus, you got to realize during cold and flu season, there's 200 other respiratory viruses in the flu that cause infections. So if you notice, every year, tens of thousands of people die of respiratory infections in this country every year. They had nothing before even the coronavirus came around. And these are people in the nursing homes, people who are sick, who are exposed to everyone, and there's no way to stop. If you are sick, just common sense, wash your hands and keep your distance like we're doing now. But nothing's 100% right now. So. And that completes another episode of Medical Matters about the coronavirus. I'd like to thank your lovely Daniel Vargas for coming and joining us today on the show to bring your questions and hopefully shed light about some of the misconceptions that are going around, and hopefully reassure everyone that even though the virus is going around and spreading, it's not as serious and killing everyone. It's not the end of the world. Definitely want to play your part. Stay safe, wash your hands, social distancing, and protect. Not if you're healthy, it's not to protect you, it's to protect everyone else. So let's do our part and we'll get through this together.